Okay, so I want to say dystonia, but you actually can communicate it so much better. So what's going on?
So for about 3 years now, I have been dealing with a strange movement disorder where I can't relax my head or neck muscles. And anytime I try to relax them, I get jerking movements back and forth very violently. And it also happens in my eyes. The muscles that are connected to my eyes, when I relax my eyes, they start jerking violently back and forth. I've seen multiple movement disorder specialists, and they can't put a label on it. They say, it's not quite dystonia, but we don't really know what to call it. I also have severe neck pain and a lot of head pressure symptoms like brain fog, tinnitus, pulsatile tinnitus, blurred vision, and visual snow syndrome.
And when they did a spinal tap, when they removed I know they did it as a test. Dr. Fargen did it as a test.
Yes, so I got some testing done with Dr. Fargen in North Carolina, and he does a spinal tap as a provocative test. Any other neurosurgeon in the country will tell you after a spinal tap to go lay down for 24 hours. He tells you not to do that, to do all the things that normally bother you and see how you feel. So I went home and I did that after it. Also, he drained my pressure. My opening pressure was at a 20, which on paper is not that high to meet the technical criteria for intracranial hypertension, but he considers it too high for an EDS patient and said that I did have intracranial hypertension. He drained it to 10, and I went home and almost all of my symptoms were better. My dystonia, my neck pain, my brain fog, tinnitus, blurred vision, possibly the visual snow. I don't remember exactly that, but all of my symptoms got better for about 6 hours or so until the pressure eventually goes back up.
Okay. All right. Come on over to the screen. So there's a rule. If you can make it go away for a moment, you can make it go away forever. So that is a wonderful teaching moment. It's going to change so many things. The turbulent CSF, the high pressure. All right. So this is the scan we did on you. We see that you already got one stent in there. You might end up getting another stent before it's all done. Let's go inside the cranial vault. You have this would be a good shot. You were born with a vascular anomaly that your left transverse sinus is hypoplastic and diminutive, and the right one is actually not only your dominant one, it actually seems to be like doing both. So it's almost like anything that interferes with your right jugular is interfering with both jugulars. It's like a 2-for-1 sale. Okay, so you can see how the atlas is digging into it there, and we'll show you in a few minutes how it's in play. But I think the biggest thing here, and we're going to call it dysautonomia. Add that to your list. I changed this. We'll bring it over here. Okay, this is the screen. We're going to run through these. All right, so the venous congestion. This is a view showing the atlas, how far the atlas has gone up to the right, and it's gone very far forward too. Now with the dystonia, for how long have you had the dystonia?
3 years.
Now with the 3 years of dystonia, the neck is changing, and you can see how she's spraining her neck, and she's got the same thing you'd see in Osgood Schlatters. She's got that going on her neck, and she's got these facets that are all unhappy and causing a great deal of pain that need to have some back pressure on them so that she doesn't cause more problems. Anyway, the atlas has gone way up to the right. There's a good shot of that vascular anomaly. We did find that this internal carotid is tortuous, like there's some fascia pulling down. We didn't actually go after that yet. But this is the thing. These first ribs have dropped down on both sides, and they're not even attached on one side. Actually, both of these are down. Now you've already had a stellate ganglion block in here, and I'm assuming they did not know that these first ribs were driving the stellate ganglion and that the sympathetic.
No.
All right, so you found the stellate ganglion block all by yourself. God bless you. Again, showing the atlas up to the right. This is a center line of the foramen magnum. Look how far displaced the atlas is to the right and gone forward, and it is interfering with that jugular. So yeah, you might end up having the atlas transverse process shaved, just because with the dystonia and this movement disorder, we're having a hard time getting you to hold the adjustment. The x-ray showed you did hold a portion of the adjustment today. Right, you know what, let's close that out here. Right, so disafferentation. Disafferentation is the brain is getting the wrong impulses. If you flex your elbow, your bicep muscle contracts, your tricep muscle gets inhibited, your brain will turn off the tricep muscle so you can actually bend your elbow. So that's inhibition from movement. So what happens is that your disafferentation is when the brain is getting the wrong impulse, the wrong information from muscles and vertebra and things in the position that it's not in. So here you can see how far this first rib is dropped down. So the scalenes that are going to be stabilizing you are not going to be able to modulate correctly. And here you can see this one is not even, it's dislocated. It's not even attached. It's free floating. So the scalenes keep you from having a bobblehead. So this disafferentation is from the scalenes. It's like somebody being on an earthquake. People talk about when they go through an earthquake, it's very unnerving to have the ground shake underneath you. You're used to having it being a stable structure. So these first ribs that the scalenes hold and stabilize the neck, they're wobbly. They're giving aberrant impulsing information. So your levator scapula in the back is going to be firing off abnormally. Your SCM, and when we look at you, you can see how the musculature in your neck is kind of corkscrewing because some muscles are activated and repeatedly activated, and others are inhibited. Right. So as far as a solution, I'm still actually about 2 weeks. I'll be sitting down with another surgeon to see if I can talk another surgeon into reattaching these on some people, because this is what we're finding. But right now, as it is, prolotherapy to tighten up these ligaments, get these things to not move so much. So we want venous drainage, because we know the cerebral spinal fluid drains into the venous system by a pressure gradient, and these shades of gray pathologies are difficult to define. And the normative data that's out there is not, it needs to be upgraded, updated actually. So we want to optimize venous drainage so we can optimize cerebral spinal fluid drainage through the normal pathways. And again, I think we're kind of stuck here with the dystonia and all the moving parts here. So again, shaving the transverse process here, putting a stent over here might be something you do next year. Obviously, we adjusted your atlas, and we'll do everything we can to help you. Anything else you want to talk about? Anything you want people to know?
I mean, I really wanted to be on the video because I know you don't normally show the patients, just because I have not found many other people with these movements like I've been having, and I've been to 20 plus different doctors, and I just haven't gotten a lot of answers. So I just really am passionate about sharing my story and trying to get it out there to find other people that are going through something similar like me, who also have hEDS, so we can, find hope and healing.
Right, so they can make comments on this video, and you'll make contact with them, and
Yes.
you guys can get to know each other
Definitely.
and help each other, a community.
Absolutely.
Okay, great.
Awesome.